Since the outbreak of the Syrian crisis and the rise of ISIS in 2011, over 5 million people have fled, most of them to Syria's neighboring countries, about 250,000 to the Kurdistan region of Iraq. Due to the atrocities committed by ISIS, another 1 million people from within Iraq have sought refuge here, causing a massive exhaustion on the local resources. Qudra Programme aims to strengthen resilience of refugees, IDPs and the local population of host communities. In North Iraq, Qudra is working together with the local administrations to improve crisis management and living conditions of the resident and displaced populations. The project range is broad, but the principles are always the same: small-scale, quick-impact projects, on the community level, and always implemented by the local administrations. For instance, new school desks were essentially needed in 3 selected districts of the Dohuk Governorate. Quickly, a refurbishment project for worn-out desks was initiated. Local people in need of additional income get an opportunity for temporary employment, and the schools are enabled to provide their students with an improved learning environment. This school on the outskirts of Dohuk is the only one serving children and youths with disabilities. Here, additional important equipment was provided. Among them, surveillance cameras to improve the children's safety. Handrails were installed to guide blind pupils through the building, thus enhancing their autonomy. Other activities focus on important infrastructure improvements in the local communities. Public roads are reconstructed, irrigation is supported, and the electricity grid is expanded and maintained, resulting in tangibly improved living conditions. In the pediatric hospital in Suleymania, the intensive care unit has been renovated and is now being equipped with modern medical equipment such as an improved oxygen supply system. Approximately 1,000 children with severe health conditions shall be treated here yearly.
The most important point in renovation of this new unit, we can provide critical patients and we can save the life of a lot of patients here, because previously we didn't have such quality of care like that.
Maintaining and expanding the public service infrastructure in host communities is one essential focus of the Qudra Programme in North Iraq. Another aspect is to improve people's livelihoods through direct support measures. In the agricultural sector, dairy, sheep and goat farming plays a key role for yogurt and cheese production. In many places, the animals are still milked by hand, which is less effective and causes severe orthopedic stress on mostly women workers' wrists and hands. Milking machines provided by the Qudra Programme enhance the agricultural productivity and reduce the adverse health effects. 150 milking machines were distributed to farmers, essentially to those who employ shepherds of the displaced communities. Quick impact projects that nevertheless provide long-term effects. This objective also goes for Qudra's support of Peshmerga veterans severely injured in the fight against ISIS. In close cooperation with the Ministry of Peshmerga, veterans with disabilities and in urgent need of economic support were identified. For these veterans, ideas for future livelihoods were developed and the necessary startup investment for each small business was provided. One example is Mohammad Mahmoud Ibrahim. He was severely wounded in a bomb explosion near the city of Kirkuk during the war against ISIS. After the acute injuries had healed, economic prospects were bleak. The whole family suffered from the trauma. With the help of the Peshmerga Ministry and Qudra, Mohammad Ibrahim could open a small store for household goods on the outskirts of Erbil, enabling him to complement his scarce veteran pension with additional income from the store. As Mohammad Ibrahim's wife Gazung confirms, the entire family now profits hugely from the improved financial and emotional situation. Through Qudra's community-based approach, people's lives and livelihoods have changed in a tangible, positive way. The service delivery capacity of the local government has been increased. 250,000 people from the local and displaced population will benefit from further community support projects implemented in the region by the end of June 2019.